Welcome, Greek U Nation, to episode number 159 of the Fraternity Foodie Podcast. I am your host. I am Mike Ayalon, CEO of Greek University. I am a speaker. I am the author of the book From Letters to Leaders, Creating Impact on Your College Campus and Beyond. Fun fact, besides my work at Greek University, I also work for the Center for Health and Human Services at Middle Tennessee State University. My role there is to serve as the Wilson County Opioid Response Program Coordinator, and we're getting large grants from the federal government to combat the opioid crisis locally here in Tennessee. So there's a lot of work that you might not know about that's happening behind the scenes. Now, we call these episodes the Fraternity Foodie Podcast because there is nothing like great food to bring fraternity and sorority leaders together, to bring college students together, to talk about some of the important things that are happening on college campuses and how we can prevent disasters from happening. And I think we can, especially with the fraternity and sorority community. Now, a lot of the college students that I've been talking to, they are very frustrated with the lack of available resources for mental health on their campuses. And I want you to think about, what is the wait time like to get an appointment with a therapist on your campus? Many times that wait time can be weeks, and that is frustrating. That's something that I think we have to address. Our guest today is a physician assistant who has been practicing family medicine for the past 6 years. In addition to working as a medical provider, he is a speaker who focuses on spreading awareness, education, and encouragement to others regarding mental health related topics. The topics include anxiety, depression, substance use and abuse, suicide prevention, and post-concussion syndrome. Not only does he have professional experience, but he has personal experience in overcoming mental health issues. He is passionate about eliminating the stigma that is associated with these topics so that others feel less alone when dealing with these increasingly common issues on college campuses today. Welcome to the show, Alex Marsh.
Hey, thanks for having me.
Alex, it is great to talk to you today. I am so excited that you're going to be talking today about mental health on college campuses. And I wanted to start with your background because you chose one of my favorite universities out there, Central Michigan University. I'm curious, why did you choose Central Michigan?
Yeah, I'm a Michigan native. I grew up in Midland, Michigan, so it's about 30 minutes from CMU, which was part of the decision. But yeah, man, I just love the size and the school pride that CMU has. Just a really fun, down-to-earth culture. And they have really good academics as well. They have a great graduate physician assistant program. So I was involved in their pre-PA program in the health residential college, which, again, it was a great experience for me and a big reason why I went to CMU in the first place.
I love it. I've been to a couple of football games at CMU, and I tell you what, the school pride, I mean, it's just overflowing. I love the atmosphere. That was awesome.
Yeah, it's a good time.
That was a really good time. Now, you got your Master of Physician Assistant degree there as well, and you work with mental health patients on a daily basis. So you're screening, you're diagnosing, treating, and helping to manage their illness. The most common illnesses that you work with are depressive disorder, general anxiety disorder, panic disorder, PTSD, insomnia, and stress reactions. I'm just curious, what motivates you to spend so much time working with mental health patients specifically?
Yeah, it's by far my favorite population and demographic to work with, and I just love, pretty motivated to work with these people and patients just to make them feel less confused and less ashamed about what exactly they're struggling with. A lot of patients are, it's tough to identify some certain feelings and emotions. So yeah, I just really enjoy getting to know them and making them feel comfortable and relating to them, and opening up with my own personal story and struggles with anxiety and depression and things like that. And so it's just really rewarding because I've been in their shoes, and I've been the patient, and I've been, the one looking for help and for understanding. And so it's just pretty fun and rewarding for me to like I said, relate and get on their level and just be, a lot of times they're pretty surprised and open to have a medical provider, like I said, be so open and honest about their personal struggles. And I've just seen a lot of success with these patients, kids, teenagers, students, adults, and just seeing their improvement and their improvement for their quality of life too. So yeah, it's really motivating for me.
Yeah, sharing your personal story is huge. I'm sure for
Hmm.
the patients, but definitely for college students that are listening to you speak, because
Hmm.
then you relate to them on a whole different level. They're saying, this guy gets it. He's been exactly where I'm at right now.
Yep, exactly. Yeah, and the places I've worked have been surrounded by a lot of college campuses. So I've seen, you know, countless amounts of student athletes or just students, et cetera. And yeah, we get along and connect really well.
Yeah. The biggest complaint I hear from college students today, and I'm on campuses every single week talking about all kinds of topics, whether it be hazing prevention or sexual assault prevention or alcohol and drug abuse prevention. The college students always talk to me about the same thing. They talk to me about the long wait to see therapists on their campus. And as you know, 11 years is the average delay between the onset of mental illness symptoms and treatment. So how do we get to treatment faster for college students before it's too late?
Right, exactly. Yeah, and the 11 years is a combination of that stigma involved and the fear of getting help, and then also, like you said, the lack of resources at times and just the therapists that are available and on campuses. There's just such a need for it. So yeah, as a PA, as a PA, I would say and recommend to right from the first day a student gets to campus is to be sure they're first aware of all the medical resources available to them and getting established with whether it's the provider or a doctor or a PA on campus. And sometimes it needs to be somebody off campus too, just to expand their resource circle. Other good things that students can look for are there's a lot of good online resources and therapists available. Some are called Talkspace or BetterHelp are good. You can have access to therapists and counselors every day with that. There's also certain other apps that are good to do. And then I would also encourage everyone just to be proactive in their mental health and preventing worsening of the problems. Like you said before, it's too late. So just really educating and encouraging the students on prevention and staying mentally fit and other ways to healthily cope with stress.
Yeah. It's so interesting that you say mentally fit. We always talk about our bodies and we talk about staying physically fit,
Hmm.
and working out at the gym, but we don't talk enough about being mentally fit, right? Why is
Exactly.
that? I mean, it's unbelievable to me how we can't talk about it the same way.
Yep, I feel the same way. I'm just really trying to bring encouragement and awareness to that, like you're saying, as far as being mentally fit, and it's just something that's so overlooked and something that just doesn't want to be talked about. But there's a lot of practical ways that we can all stay emotionally and psychologically fit and at our best and preventing issues like we do physically. And if like you were saying, if someone has a physical diagnosis or problem, whether it's a thyroid or blood sugar or an orthopedic like a knee or a joint problem, everyone's happy to talk about that and ask people how they're doing, and it's easy to go get treatment. And so yeah, I just want to bring awareness to that and translating it to mental health. If you're struggling with anxiety, depression, like that's what medication is there for. That's what therapy is there for. That's what friends are there for, to kind of to talk about. And so yeah, I hope we can all normalize that like we do our physical health.
hmm Maybe it's helpful if we do a little bit of role play here, because suicide is the second leading cause of death between the ages of 10 and 34. So if we learn that a friend, a fraternity brother, or a sorority sister is contemplating suicide, what should our response be?
Hmm. Yeah, it's a pretty important topic to touch on. The response should be, just from the medical background, just making sure that they are they're safe where they are, making sure that asking if they have a current plan of hurting themselves, asking them if they've had a previous attempt, letting them know that they're loved and not alone. You know, it's not our job to play doctor or therapist. We don't need to try and get into all the background reasoning. Our main job is to make sure that they're safe and that they're not alone and that they're not isolated. And yes, just asking them if there's anything that you can do. And then really the big responsibility we have is just getting people to the appropriate help. If they're actively suicidal, they have a plan, etc. You know, we need to do what we can to get them to a doctor. Whether, you know, if that's at the emergency room, then that's always an appropriate place. If someone is passively suicidal, which means they don't have an active plan, they don't have, you know, a weapon or medication that they're going to currently hurt themselves with, but you know that they're contemplating it. Like I said, making sure they're not alone and really getting them to professional help and getting them to the doctor is our main responsibility.
Yeah. The mental health first aid certification, I feel like, is something that is very underused.
Yep.
I'd love to see more fraternity and sorority chapters get that certification together as a group, because
Yep.
you really practice, you do the role play, you practice talking about mental health and talking about suicide prevention, and you actually talk to your partner, let's say in the certification course, and you say, literally, word for word, are you contemplating suicide right now?
Yep.
And
Exactly.
just getting into the habit of having those words leave your mouth, I feel like helps to prepare you for when you're actually in that scenario and feeling comfortable to be able to say that and verbalize that. And we shouldn't be afraid to say those words.
Yep. Yeah, I completely agree. And yeah, I mean, it's a tough situation to be in, for sure. And yeah, we need, like I said, we need to do what we can to be prepared for that. And if you're even by asking someone if they're suicidal or whatnot is not going to encourage that. You're not doing anything wrong by doing that. It's not going to encourage them or give them any new ideas. It's the right thing to do. And that's what I love about Greek life too, is the community that is built in within that structure, and it is pretty invaluable. And yeah, I just really want to encourage everyone to use that space as a safe space for people, and to really be aware of looking out for everybody and making sure that everyone is comfortable and okay, you know, talking about their problems or their struggles.
Yeah. Now, coping with stress has been a major issue during this pandemic for college students. I think college students were fearful that they were going to get sick. I think they were fearful of loved one getting sick, like a parent, for example, somebody who maybe has a compromised immune system, like my father. They might be under financial pressures, right? A lot of people lost their jobs, so that is an issue. Isolation, I don't even have to tell you how bad that is in terms of stress on people. We're not built to be in isolation for long periods of time. And I'm sure there will be new stresses that are coming this fall for students as we return to the in-person classes, the in-person events, and large gatherings on college campuses. So what's your advice for college students in terms of coping with the stress that is going to be coming this fall? Do you have any advice on how to cope with it?
Definitely. Yeah, I do. Yeah, really positive ways of coping. There's quite a bit, and sometimes these recommendations sound a little bit repetitive or basic, but they're all proven to be effective. And these things include getting good sleep, makes a huge difference. Physical activity and exercise make a huge difference. Limiting sugar and alcohol can make a big difference. You know, like you were saying, Michael, not isolating and trying to take time for fun activities and as an outlet is always a really good idea. And I always encourage everyone to have one safe person that you can confide in and be honest with if you are struggling with stress or anxiety, etc. You know, we don't have to share our struggles with everybody we see, but even having one person to talk to makes such a huge difference of preventing that isolation, emotionally and physically. So those are all effective and proven ways to help cope.
Mhm. I'm very concerned for the fall in terms of substance abuse. I think there is a fear of alcohol and drug abuse rising to even bigger levels on college campuses now that we're back in person and maybe we haven't had these big social gatherings for a couple of years. So when should I get involved? What signs should students be looking for in other students, maybe fraternity brothers, sorority sisters, in terms of substance abuse? How do I know when it's time to step in and make sure I get help for this person?
Yeah, that's a great question. It's a topic that I speak a lot on as far as substance abuse. And yeah, if you see a brother or sister or friend that's you might be concerned it's becoming a problem, and the changes that you're going to be looking for include changes in their normal behavior or even personality. If you see them missing class or missing work because they're hungover, or they're wanting to drink or use, seeing if there's a big change, if they're becoming more irritable, or big mood swings, or changes in appearance even. Isolating when someone is not accustomed to do that can be a big sign. And just being aware for yourself and for others, just with the amount that someone is drinking or using, or making excuses for it, such as, oh, I need it to relax, or I need it to feel normal. All of these are red flags that we should be keeping an eye on. And if you do notice these things happening or changing in the people around you, it's always good to just ask how they're doing and see if there's any way that you can help. And it's addressing your concerns appropriately.
Yeah. I love that you're a male talking about mental health. I think that's so important because men haven't traditionally done a great job in terms of talking about mental health openly. Why is that? And what can we do to reduce the stigma for men who are seeking mental health support and treatment?
Yeah, I think it comes from just our society and culture, obviously, growing up and kind of being taught, and seeing examples in our culture of what quote unquote masculinity should be, and that's typically being hard and not showing emotions, and correlating emotions with weakness, or being made fun of or picked on for if you're sad, or if you're depressed, or if you're whatnot. And I've been through that. We've all been through that and experienced it to some degree, and it's just such a harmful stigma and stereotype to have. And I think ways that we can reduce the stigma are just talking about it more, and that's what I'm trying to do, is get out and continue talking and sharing my story and struggles with depression and anxiety and suicidal thoughts, etc. And just talking to guys about how I was able to kind of cope and deal with that. And then also from the medical professional side of, seeing a lot of male patients and seeing how long it took them to come in. And a lot of times somebody, whether it was their wife or girlfriend or friend, had made them come in, and they didn't really want to talk about it up front. But then once I share my personal story, it just becomes so much easier for them to talk about. And then they know that they're not going to be judged, and they know that it's a safe space. And I mean, everyone has emotions, and everyone needs, whether you want to admit it or not, everyone needs to talk about it and wants to talk about it. So just encouraging a safe space and building each other up is really important.
Yeah, I agree completely. And I think by you sharing your story, you're definitely empowering other men to open up about it with, their chapter brothers, with their family, about what's really going on. I'm also a big sports fan, and I look at, athletics and sports like the NFL. There's obviously a protocol that you have to go through for athletes that have a concussion on the field. There's a protocol that's involved there, which I think is great. I'm wondering about, college athletes and, whether those protocols are really in place or not. For student athletes, 15 to 30% of post-concussion syndrome cases cause major depression. So if I'm on a college campus and I'm, friends with a student athlete on campus, what signs should we be looking for in post-concussion syndrome cases?
Mm-hmm. Yeah, there's quite a few signs to be looking for. And, at work, I've worked with a lot of athletes and a lot of, whether it's high school or college, doing screening, doing follow-up treatment. And a handful of years ago, I had a pretty bad concussion myself from playing basketball. And so I totally understand what it's like in the process of going through and things. Yeah, signs that we should be looking for ourselves and sometimes for others is, like I said, quite a few, whether that's having ongoing headaches, decreased memory or concentration problems, changes in mood or energy levels is a big one. Sometimes it can cause different anxiety or panic, and it's tough to sometimes regulate your emotions after a bad concussion, and it's just tricky, whether it's the physical signs or the mental signs, and a lot of times they can overlap with other mental health problems, like I said, anxiety and depression. And so just keeping an eye on yourself and really being honest with how you're feeling. If you're an athlete and you think you might have had a head injury or even a mild concussion, being honest with it and telling someone and getting rest or getting that treatment is just vital to preventing more serious signs and problems of that post-concussion syndrome, such as major depression. And the success rate of you recovering from it is so much faster and more effective the sooner we do something about it. So like I said, I know firsthand how hard it can be to be open and honest with that. Everyone wants to return to play. Everyone wants to return to going back to work and what have you, and we can all do that. And I just encourage everyone to, like I said, be honest and communicate with what you're feeling to somebody.
That's great that you shared that. I mean, I know a lot of the fraternity and sorority students that are listening now, they're heavily involved with things like intramurals and Greek week. And, I see all these sports competitions happening and I'm not really sure what the concussion protocols are on fields like that. So I think that's certainly helpful. So that way, if you or somebody is experiencing any of those symptoms, that you should go and seek help. So that's really good. And, now you're speaking for high schools, you're speaking for college students, small businesses. Your website is alexmarshspeaks.com. So people should go and check that out. I think that's great. Talk to us a little bit about your experience as a public speaker, because a lot of our listeners, dream about being a public speaker one day and sharing their experiences. What's your favorite part about being a public speaker?
Mm-hmm. Yeah, man, I really love it, and it's just really fun and a cool opportunity just to be able to go and connect with students and with people and making connections and I just love making people feel comfortable, and when talking about mental health and being able to be real and down to earth and relatable. I just really enjoy that, and just being able to encourage everyone and to build them up, like I said before, using past medical and personal experiences and just trying to be a good example to others and just try and make a change at these sororities and fraternities and college campuses, and in our society and culture as a whole. And yeah, I just feel pretty fortunate to be able to meet so many people and to speak publicly on the topic of mental health.
Beautiful. Now you're in Midland, Michigan, and I have to be honest with you, we love good food here at Fraternity Foodie. I'm always talking about good food. So if I'm in town, if I'm in your neck of the woods, what's your favorite local restaurant that I need to go and check out?
Yeah, my favorite one it's called the Maple Grill. It's just outside of Midland. I was just there last weekend with my brother, and they have the best wings that you'll ever find, man. They're just perfect. And that's my go-to for sure.
Nice. See, now you're talking my language, but I have to, just preface that by saying that I went to school at the university at Buffalo. So understand that I know very clearly what a good buffalo wing is. So when I get to Midland, Michigan, and I go and check out this restaurant, I'm going to come back to you and I'm going to say, listen, you don't know what a buffalo wing is.
Yeah, let me know. I know you have a high standard.
Yeah, there's a very high bar for me on buffalo wings in particular, because I know where it was invented, I know where it was perfected, and I will tell you that is in Buffalo, New York. So if you ever get a chance to visit, go and hit up Duff's, and you will experience what a delicious buffalo wing really is.
Yeah, I can't wait.
That's awesome. All right. So if our audience, if they want to bring you in to speak on their campus, or maybe they have a small business and they want you to speak to some of their employees, where is the best place for our listeners to go and to connect with you?
Yeah, going to my website is the best place. Like you said before, it's alexmarshspeaks.com. And on there is my email, which is info@alexmarshspeaks.com. I also use social media platforms, Instagram and LinkedIn, and both of those are, again, Alex Marsh Speaks.
I love it. I love it. This has been awesome. Thank you so much for spending time with us, talking to us a little bit about mental health and substance abuse prevention. I love the work that you're doing. It's so important. And I think the expertise that you bring in, I think is also really important. So that way you understand the science of it and you can explain some of the things that are going on to the college students. So thank you so much. This has been great. And I can't wait to see you on stages all across the country. Hopefully we're going to meet up on the road at some point.
Yeah, thanks for having me, Michael. I appreciate you.
My pleasure. All right. And to all of our listeners, if you enjoyed Alex's talk today, make sure that you like it. Make sure you share it with other students on campus. And we will see you on a future episode of the Fraternity Foodie Podcast. Thanks so much. And we'll talk to you soon.